Assalamualaikum, everyone. I'm Dr. Sazidul Islam, Vice President of the Australia-Bangladesh Health Forum. Thank you all for joining us today. We truly appreciate your time and interest. Today's webinar focuses on GP pathways in Australia, and it is proudly organized by ABHF. Before we begin, I would like to briefly introduce our organization. ABHF was born from a shared vision among a group of Bangladeshi doctors who believed that health professionals of Bangladeshi origin in Australia needed a common platform, a place where we could connect, collaborate, support one another, and contribute meaningfully to both our professional community and the wider community. Over the time, that vision expanded beyond doctors to include dentists, pharmacists, nurses, allied health professionals, academics, and many others. Today, ABHF stands as a unified voice for Bangladeshi Australian health professionals, promoting networking, professional development, peer support, advocacy, and community initiatives. This webinar series is a part of our ongoing effort to share knowledge, guide newcomers, and strengthen professional pathways within the Australian healthcare system. I'd like to sincerely thank our speakers for their time and expertise, and all the participants for joining us today. Your presence truly reflects the spirit of collaboration upon which ABHF was founded. Now, as we move forward with today's session, it is my pleasure to invite Dr. Rumana Afroz, General Secretary of ABHF, to share the aims and objectives of the webinar and to the introduced speakers and panelists. Over to you, Dr. Rumana.
Thank you, Dr. Islam. Assalamu alaikum, everyone. I warmly welcome all our participants joining us today for our webinar for GP pathways in Australia. In today's webinar, we will briefly cover the GP pathway and practical guidance on securing GP jobs in Australia, along with real-life experiences from our speakers. We are honored to have two excellent speakers with us today. Dr. Sharmin Akter, currently working as a GP in Queensland. Dr. Mohammad Mansurul Islam, currently practicing as a GP in Queensland. We are also privileged to have our respected panelist, Dr. Suprity Chowdhury, General Practitioner at Windsor Family Practice, and Dr. Suprity Chowdhury, General Practitioner at Advanced Medical Practice in Windsor. We'll have a question and answer session at the end, so please feel free to write your question in our chat box. Now, without further delay, I would like to invite our first speaker, Dr. Sharmin Akter. Over to you, Dr. Akter.
Thank you, Dr. Afroz. Good evening, everyone. Thank you for joining today's webinar on GP pathways in Australia. I'd also like to express my appreciation to ABHF for organizing this platform, allowing us this opportunity to share our experience and help you guys to achieve your GP career goal in Australia. I'm Dr. Sharmin. I'm currently working as a GP in Queensland. Being a GP can be challenging, but it is a profoundly rewarding career that offers immense appreciation from the patients and also from the colleagues as well. And it brings lots of professional satisfaction as well. As I went through this pathway not so long ago, I understand that the process can be confusing and requires patience. However, with a proper plan and consistent hard work, it is entirely possible to succeed. Today, we will provide you a clear step-by-step concept of this GP pathway. We have divided our presentation into two distinct segments. For overseas doctors who are currently in Bangladesh and preparing for AMC Part 1 exam, our next speaker, Dr. Mohammad Mansurul Islam, will discuss this in detail. He has achieved a wonderful success through this pathway. For doctors who are currently in Australia and those who already hold the limited registration or beyond, this is the pathway I will be focusing on tonight. My goal tonight is to give you a clear roadmap so you can make confident and informed decisions about your career in Australian general practice. Let me start with this big picture. This diagram shows the journey from arriving in Australia to achieving fellowship. Whether you come through the AMC Part 1 or Part 2 or via the FRACGP pathway, our destination is the same, to achieve the fellowship as a recognized GP specialist. We will move through stages of registration from limited to professional or the general registration and can then enter into the GP training pathways. I want you to see this picture not as a maze, but as a series of clear, achievable steps. Each milestone you reach, it will bring you closer to practicing as an independent fellow GP in Australia. Now, before getting into details, I would like to briefly share my own experience. After passing my AMC Part 1 and Part 2, I secured a job offer in a hospital in Australia in Queensland, which helped me to obtain my general registration. I then received my permanent residency via 190 visa. Then I started my GP training under the RACGP pathway and the AGPT pathway under RACGP in 2024 and successfully completed it this year. Every step felt daunting at the time, but looking back, each one was manageable when I focused on each milestone at a time. Now, this is the pathway, is my pathway. Yours could be different, and that is totally perfect. What matters is that you need to keep moving forward. If you have any questions regarding my journey or anything in general, please contact me through the ABHF. One of the first big decisions we will face is choosing the college. Either it is RACGP or ACRAM. Both of the colleges have beautiful pathways towards fellowship. RACGP offers a 3 to 4 year training program with metropolitan, regional, and rural options, leading to the FRACGP fellowship. This 4th year is actually optional and for rural generalist pathway. ACRAM is a 4 years program primarily based in rural and remote settings, leading to FRACGP with extensive advanced skills training. Think carefully about the kind of GP you want to become and why you want to practice. If you are drawn to rural medicine and procedural work, ACRAM could be a great fit for you. If you want more flexibility regarding the location, RACGP may suit a bit better for you. Neither choice is wrong. It is about what aligns with your professional and personal lifestyle. Now, hospital rotations are a critical foundation for GP training. Both colleges, RACGP and ACRAM, require them, but the specific vary. RACGP typically requires a minimum of 3 months in secondary care and 3 months in emergency care, also 10 to 12 weeks in pediatrics. Whereas ACRAM, with its focus on rural and remote medicine, adds 12 months in rural or remote areas classified as MM 4 to 7, plus options for advanced specialized training in areas like pediatrics, obstetrics, and anesthetics. The key takeaway is to check your chosen college and pathway early, because the hospital experience you gain now directly shapes your training eligibility later. If you have already completed these rotations in overseas, or you have previous hospital experience, you can easily apply for recognition of prior learning and experience to reduce your required hospital training time on this. There are 5 main training pathways available, and understanding the difference is crucial for planning your career. AGPT is the flagship government-funded program available through both RACGP and ACRAM. FSP, the Fellowship Support Program, is RACGP specific and designed for the doctors who may have limited registration. PEP is a specialist comparability pathway with experienced international GPs. RVTS focuses specifically on remote and Aboriginal health, whereas the independent pathway under ACRAM is a self-funded option. Let me walk you through the eligibility details for each of these. Now, eligibility for each pathway depends on several factors. You need to consider which college is offering, what level of medical registration you hold, your visa status, and whether the pathway is government or self-funded. There are also entry assessments to consider as well, with the required training time and training location, because it can vary. I'm going to break each of these down over the next few slides that you have get a clearer picture. Medical registration requirements vary significantly across pathways. AGPT requires general registration. FSP is more accessible, accepting general, provisional, or limited registration at AFRA supervision level 2 to 4. PEP accepts general, limited, or provisional registration. RVTS accepts mostly all types of registration, but excludes level 1 limited registration. The independent pathway is the most flexible, accepting general, specialist, provisional, or limited registration. Understanding where you sit in the registration hierarchy will help you identify which pathways are open to you right now. Visa requirements are often a major concern for international medical graduates. AGPT accepts citizens, permanent residents, and several temporary visa categories. FSP requires Australian or New Zealand citizenship, permanent residency, or an approved temporary visa. PEP is specifically designed for those on a temporary skill shortage visa subclass 482. RVTS requires that temporary residents who have at least applied for permanent residency. The independent pathway excludes student visa holders but accepts most other categories. Check your visa status carefully against these requirements as you plan your pathway in the future. Funding is another critical consideration. AGPT and RVTS are fully funded by the Australian government, meaning your training costs are covered and you receive a salary during your training time, which also involves your annual leave and the parental leaves as well. FSP is self-funded, and PEP and independent pathway may receive some government subsidies depending on your location, but they are primarily self-funded. If funding is a major concern for you, then the government funded pathways offer significant financial advantages. Let me give you a clearer picture of the actual cost involved. On the government-funded side, AGPT and RVTS, as I said, it provides a salary during training. However, exam fees are still payable separately. On the self-funded side, costs add up. FSP program fees vary by cohort. PEP costs around $12,500 plus application fees. The Akram independent pathway is approximately $25,000 for education plus annual membership. Exam fees across both colleges range from roughly $6,000 for Akram to over $11,000 for all 3 RACGP exams. My advice is to budget early and explore any available financial support or employer-sponsored arrangement if you can. Now, training duration and location requirements round out the eligibility picture. Most pathways take 3 to 4 years, except FSP, which extends to 5 years, including a consolidation phase of up to 36 months. All pathways except RVTS allow training in modified Monash model areas 2 through 7, giving you a range of metropolitan to remote options. RVTS specifically requires MMM 4 to 7 for the remote stream, whereas the Aboriginal medical services available in MMM 2 to 3. You should consider how the location requirements fit with your personal and your family situation. Now let me dive into each pathway in more details. Starting with AGPT, the Australian General Practice Training Program. This is the most well-known pathway and follows the structured progression through hospital training, which is 12 months. Then you will go to 2 years of GP trainings. Including that 2 years of GP training, 6 months has to be the extended skills training. And finally, you sit for the fellowship. It is a well-supported program with supervision, teaching, and clear milestones throughout. If you can secure a place, it is an excellent pathway to fellowship. Now, the Fellowship Support Program, or FSP, is particularly relevant for many international medical graduates. It has 2 entry points. Standard entry, which is the foundation term. It is designed for the applicants who have limited registration, limited Australian experience, and who doesn't meet the pediatric competency requirements. Advanced entry goes directly into FSP Term 1, and it is available for those with general registration, broad Australian GP or hospital experience, and demonstrated pediatric competency. For the enrollment in 2027 January intake, you will need at least 2 years of post-medical school experience. I would suggest you to assess honestly why you fit and choose your entry point accordingly. Now, FSP program structures spans up to 5 years in total. It begins with the foundation program, which is 6 months, if applicable, followed by FSP Term 1 and Term 2 at 12 months each, and then a foundation consolidation phase of up to 36 months to complete your exams and achieve the fellowship. The total 24 months of education and training plus the consolidation period. While it is longer than AGPT, but it provides a supportive framework for those who need more time to build their Australian clinical experience. Do not see the length as a disadvantage. See it as an investment in a thorough preparation for an independent practice. The remote vocational training scheme is a unique and rewarding pathway for those passionate about rural and remote medicine. It has 2 streams. The remote stream requires practice in MMM 4 to 7 and funds 22 doctors per year with up to 11 positions per intake in January and July. The AMS stream, which is based on Aboriginal community-controlled health services, in MMM 2 to 7, they fund 10 doctors per year with up to 5 positions per intake. Competition is very strong, I understand, but if remote medicine is your calling, this pathway offers exceptional support and deeply meaningful career. Next one is the PEP. PEP is the practice eligibility pathway. It's designed specifically for specialist international medical graduates who already hold a specialist GP qualification from overseas. To be eligible, your primary medical qualification must be recognized by AMC and listed in the World Directory of Medical Schools. You must have completed all training and exam requirements for a specialist GP qualification in your country, and your curriculum must have been assessed by RACGP. You also need 12 months of full-time equivalent GP experience in the last 4 calendar years and at least 4 weeks in the year before application. If you are an experienced GP from overseas, PEP can be the fastest route to FRACGP or fellowship. Now, independent pathway, it is covered by ACRAM, is a 4-year self-funded program leading to FACRAM and specialist registration. Core generalist training takes 3 years, includes 12 months of primary care, 3 months of secondary care, 3 months of emergency care, and 12 months in rural or remote areas at MMM 4 to 7. After that, you can pursue 1 to 2 years of advanced specialized training in pediatrics, obstetrics, or anesthetics. This pathway gives you the flexibility to train while working and is ideal for those who want procedural skills alongside their general practice. Now let us talk about something that affects almost every international medical graduate, the 10-year moratorium under Section 19AB of the Health Insurance Act. If you completed your primary medical qualification overseas or were not a permanent resident when you started your medical school in Australia, you are required to work at a distribution priority area for at least 10 years to access your Medicare rebate. After 10 years, restrictions end for permanent residents and citizens, but continue for the temporary residents. Here is the good news about the moratorium. The more remote the area where you work, the more scaling credits that you accumulate. If you're working in an RF5, very remote areas, then it will be reducing monthly 30.4 days. And you'll be finishing your moratorium early in 5 years. If you're considering rural or remote practice anyway, the moratorium scaling becomes a powerful incentive. Now, exam preparation is one of the most important investments you will make in your training. I recommend starting structured preparation at least 6 months before your exam date. Both colleges hold exams twice yearly. For RACGP, you will face three exams: the APT, which is 150 MCQ questions, KFP with 70 clinical scenarios, and the CCE, which is a clinical exam with 9 OSCE stations over 2 weekends. For ACRAM, there is the MCQ assessment and the STAMPS clinical stations, plus case-based discussions and projects. Use the RACGP exam guidelines, programs on GP learning pathway or GP learning places where you can practice the exam style question banks like AGPT, PASGP, GP Academy. They also are full of lots of question banks, questions. So you can do the preparations in a group with your friends or in a group with your colleagues as well. Now, group studies, spaced repetition, and time practice are crucial. I want to make sure you all leave today with the right resources at your fingertips. For college information, visit the RACGP and ACRAM websites directly. For the AGPT program, check the Department of Health website. RBTS has its own dedicated website, and the Doctor Connect is invaluable for finding training locations. For exam preparation, as I said, ASGP, PASGP, GP academies, they're pretty good. There are lots of other valuable institutions available as well, where you can just do the studies with your study groups and partners. Now, the RACGP GP learning platform is essential actually for the RACGP candidates. The Health Workforce Locator tool will help you to check whether a location qualifies as a GPA or not. Bookmark these resources and use them regularly throughout your training journey. In Health Workforce website, you can also find some available vacancies. Thank you so much for your time and attention today. I hope this presentation has made the Australian GP pathway feel a little less daunting and a lot more achievable. Remember, every one of us in this room has already shown incredible resilience and determination by choosing medicine as our career. The path to fellowship is not easy. It is very challenging, I understand, but it is absolutely achievable and it is within your reach. Take it one step at a time, seek support from your colleagues and the supervisors, and never lose sight why you have chosen this pathway. I wish you all the very best on your journey to fellowship. Now, I want to welcome Dr. Mohammad Mansurul Islam for his part of the presentation.
Thank you, Dr. Akhtar, for your beautiful speech today. I just want to remind all of our participants we will have a question and answer session at the end. So please feel free to write your question in the chat box. Over to you, Dr. Mansurul Islam.
Okay, so Assalamu alaikum and good evening, everyone. Thank you all for being here today. I would also like to thank ABHF for organizing such a nice webinar on this burning topic today. My name is Dr. Mohammad Mansurul Islam, working as a GP in Queensland, Australia. I came to Australia directly from Bangladesh through MC pathway and started working as a GP from the very first day of landing on this amazing country. And today I'd like to explore the journey that I have taken, a journey that was confusing initially, full of fear and uncertainty, but ended up with success due to self-belief, proper guidance, and full planning. For me, this was not only a professional journey, but also a personal journey, basically, of learning, sacrifice, patience, and persistence. I know many of you may currently be thinking about, where do I start? And is it possible? Can I do this? And the answer is yes, you can. The purpose of today's presentation is not only to explain the pathways, but also to simplify it share the practical guidance, and also hopefully give you the confidence that this dream is achievable. And I will walk you through the important steps and alternative pathways and the many registration processes as well. Some practical advice that may help make your own journey a little bit clearer. So after graduation, I spent many years working across the primary to tertiary healthcare settings in Bangladesh. Those years taught me a lot about medicine, responsibility, caring for the people. But deep inside, I always carried a dream. One day to work in a first world healthcare system, to grow further, and to challenge myself beyond my comfort zone. Honestly, the idea of the moving to Australia felt overwhelming initially. Leaving behind the familiarity, starting again, facing exam, uncertainty, and countless obstacles. It was not an easy journey for me, but sometimes a dream stays in your heart for a reason. So I decided to take that first step. And looking back today, I can say that every difficult step was worth it. So let us begin the journey of dream together, step by step. So every journey starts with a confusion. And honestly, this was exactly how I felt at the beginning. When I first started exploring the Australian medical pathway, everything seemed overwhelming to me, like AMC, APIC, AFRA, English exams, HESCI, documentations, different pathways, requirements, blah, blah, blah. So every website gave different information, every person gave different advices. And the biggest question was, where do I even begin? At that stage, it didn't feel like a straight road. It felt like standing at a crossroads with too many directions. And there were moments of doubt, moments of fear, and the moments where the dream felt very far away. But one thing stayed constant, the goal. I realized that confusion is actually the part of the process. Every overseas doctor who dreamed of working in Australia goes through this phase. So you do not need to know everything on day one. You just need to take the first step. Slowly, one by one, the puzzle pieces start fitting together. That confusion that you have today eventually becomes a clarity, and the uncertainty becomes confidence. And that dream slowly becomes reality. So let me now show you how I actually started the journey. So once I understood the journey, everything became much more structured. This is the journey step by step, the same pathway many overseas doctors follow to work as a GP in Australia. The first step is EPIC verification, through which you need to verify your primary medical qualification internationally. After verification, you will open an account in AMC portal and started preparing for the AMC exams. Then came the AMC MCQ examination, probably one of the biggest milestones in the journey. It requires discipline, consistency, and a lot of self-belief. So after clearing the AMC MCQ, next challenge is the AMC clinical exam, where communication and practical clinical skills become extremely important. Alongside that, English proficiency is another major requirement through IELTS, OET, or PT. Once those steps are completed, you need to start applying for the GP jobs in Australia. The receiving a job offer, like GP job offer, is really a huge step in this journey, because for the first time, your dream will be started to feel real. And then came the PESCI process, which eventually evaluates whether you are safe and suitable to work in a particular supervised GP role. So after that, after registration and work visa processing, allow the transition from the preparation into the actual practice. So finally, the journey will truly begin, like starting work as a GP under supervision in Australia, which could be both exciting and challenging as well. A completely new healthcare system, new culture, new responsibilities, but also a new opportunity to you. And this is not the end of the journey. The pathway continues towards the fellowship to become a GP specialist. So when people look at the final result to become a qualified GP, they often see the success. But behind the success are many small steps, sacrifices, failures, and persistence. And honestly, every single step was worth it. So this slide represents an important part of my personal journey. Like many overseas doctors, I initially believed that there was only one fixed pathway to becoming a GP in Australia. But over time, I learned that there can be alternative pathways and exceptions depending on experience, opportunities, and supervision arrangements. In my case, the journey did not follow the traditional sequence completely. So after completing the EPIC verification AIMS MCQ, I obtained a GP job offer, then completed PESCI and received a limited registration. That allowed me start working under supervision before completing the AMC clinical. At first, this pathway felt unfamiliar and uncertain. Started working in a new healthcare system while still preparing for the AMC clinical was really challenging at the time. So there were moments of pressure, self-doubt, adjustment to the new culture, new language, and a tough English accent, especially in Queensland. So, but working under supervision became one of the biggest learning experiences of my career. It helped me to understand the Australian healthcare system, improve my communication skills, and grow both professionally and personally. That helped me to pass the MC clinical really very smoothly. So later, I started progressing through the fellowship pathway to become a GPA specialist, and I'm also in that pathway now. The reason I shared this slide is to remind everyone that not every journey looks exactly the same. Different doctors may take the different routes, but you need to know the routes as well. And that's the reason of today's webinar. But the destination can still be the same. So if your pathway feels different or slower than someone, don't lose hope. Like different pathway, same destination, but still your dream is possible if you have that in your mind. Now, after passing the exam like other AMC, MCQ, or AMC clinical, that is the one part of the journey. But finding the right GP opportunity is another major step in Australia as a GP to be working here. So one useful resource is RACGP GP Recruit, where many clinics advertise GP job opportunities. And another very important source is the rural workforce agencies in each state. They help connect international doctors with the regional and the rural GP positions and often guide doctors regarding supervision and eligibility requirements. And honestly, one of the most valuable resources is basically peer communication, interpersonal relationship. So talking to doctors already working in Australia can provide practical advice that you may not find on websites about clinics, about supervisors, locations, and work culture. Sometimes they can be helpful in terms of obtaining GP job offers. So my advice is simple, like build connections, ask questions, and explore multiple opportunities. Sometimes the right guidance can change the entire journey. So you pass the MC MCQ or you pass the MC clinical, and then you got the GP job offer. Now the time to get into PESCI. So PESCI, the pre-employment structured clinical interview is an important step of many for many international doctors for entering GP practice in Australia under limited or provisional registration. It is not just an interview, it assesses whether you are safe, suitable, and prepared to work in a specific GP practice under supervision. One important thing to remember is that the PESCI is individualized to the practice, and it could be different for the different people. So the assessment may vary depending on the clinic, depending on the location and scope of work. Several providers conduct the PASCI in Australia, including the RACGP, that the Royal Australian College of General Practitioners, and ACRAM, that is Australian College of Rural and Remote Medicine, and IME, Institute of Medical Education. So my advice is simple in terms of the PASCI, that is prepare well and understand the practice you are applying for is very much important, because the PASCI is individualized to that particular practice and location, and approach the interview with confidence. Now, let's look at the overall registration pathway. So after passing the PASCI, basically, this slide basically showing you the pathway from AMC clinical to fellowship. The first step is successfully completing the AMC clinical and PASCI. And these are important requirements that assess the clinical knowledge, the communication skills, and the readiness to work safely in Australian healthcare system. After that, the next step is basically obtaining the provisional registration. As you have the AMC clinical and you pass the PASCI, you are eligible to get the provisional registration, and definitely with the supervision. So this allows you to start working as a GP under supervision in an approved practice. And once you begin the supervised practice, you need to complete at least 1 year of satisfactory supervised experience. And during this period, you gain the practical exposure to Australian general practice, improve clinical guidance, and become familiar with the healthcare system here in Australia. After completing the supervised practice requirements, you can obtain the general registration through AFRA. And the final stage basically is the pathway to the fellowship, either FRACGP, that Fellowship of Royal Australian College of General Practitioners, or the Fellowship of Australian College of Remote and Rural Medicine. So depending on your career goal and training pathway, and our previous speaker discussed all of those fellowship pathways in detail. So depending on your career and goal of training pathway, you can choose any one of those. Fellowship is an important milestone that recognizes your competence and experience as an independent GP in Australia. So in summary, AMC clinical and PASCI, provisional registration, 1 year supervised practice, then gain the general registration, then enter the fellowship pathway. Step by step, you can see the pathway become very much clear and more achievable now, you can see. So now let's discuss some of the alternate pathways to fellowship for eligible international medical graduates. Not every doctor follows exactly the same pathway. Depending on the previous experience, qualifications, and eligibility criteria, there can be different routes into the Australian general practice setting. So first pathway is for the doctors with the general practice assessment, or the GB assessment, meaning that recognized general practice experience, usually at least 3 years in last 10 years back in your home, like back in Bangladesh. So these doctors may become eligible for the area of need locations that basically dignified by the state government. Some of the locations they dignified as the area of need location. And you can work under that area of need under supervision as a limited registration. So after starting working, you can complete the MC clinical and then progress towards the general registration or the fellowship pathway if criteria meets. So without MC clinical, you can jump into the fellowship after if you meet the criteria with the general practice experience. And the second pathway in the below one, you see is for the doctors without GP assessment. So in this pathway, doctors usually enter the training and supervised practice position, we call it, under limited registration. You see that there's 2 types of the limited registration. One is area of need, and another one is the postgraduate training and supervised practice position. So after getting the limited registration, then they continue the progressing through the clinical examination the same way like the previous one, and completing the training. And then the both pathway, basically, you can enter the fellowship pathway without passing the MC clinical. If you want to pass the MC clinical, that is great. You can have the general registration and then get into the fellowship pathways. And without MC clinical, also you can get into the fellowship pathway. fellowship. If you gain the fellowship, then you don't need to sit for the MC clinical. So the key message from this slide is simple: two pathways, but the same goal. So whether through GP assessment or supervised practice training, the aim remains the same. You can see, to gain the experience, meet the registration requirements, and eventually the progress towards the fellowship in Australia. So now I would like to leave you with a few important messages. At first, the pathway may look complicated and overwhelming. There are exams, registration steps, supervision requirements, and many decisions to make. But when you take it step by step, the journey becomes much clearer. Another important point is that there's no single pathway for every doctor. You can see different people may take the different routes depending on their experience, qualifications, and opportunities, and that is completely okay. So exams are important, but success is not only about exams. So guidance, mentorship, networking, and learning from others also play a major role in this journey in terms of passing exams and in terms of gaining GP job offer. So supervised practice in Australia is also a valuable learning opportunity. It is not just an requirement. It helps you to build confidence, improve communication skills, and adapt to the Australian healthcare system. So most importantly, stay consistent, patient, and focus on a long-term goal. So progress may feel slow at times, but every small step brings you closer to becoming a GP in Australia. So even if your journey begins with uncertainty, it can absolutely end with achievement. So my saying is that keep going, believe in yourself, and your goal is really, really achievable. So before I finish, I wanted to leave you with one simple message, that is, the best is ahead. This journey is not always easy. There will be uncertainty, delays, exams, the paperwork, and the moment when you question yourself. But every challenge is also preparing you for the doctor you are becoming. Stay focused, keep learning, keep going. You do not need to finish everything overnight. You only need to keep moving forward, one step at a time. Every exam you pass, every skill you build, every patient you help, all of it matters. Many doctors before you started exactly where you are today, feeling confused, nervous, and unsure. And today they are working successfully as GP in Australia. That means you can do it too. So believe in yourself, trust the process, be patient with your growth. Your future in general practice in Australia is waiting for you. And thank you all. Thank you for patience hearing.
Thank you to all of our speakers for their informative presentation. We'll now move on to the Q&A session. We have received a number of questions from our participants today. I will go through them one by one, and our respected panelists will be answering these questions along with our speakers. We'll try to answer as many questions as possible during this session. If we are unable to cover all questions due to our time limitation, please feel free to reach out to us via email at abhealthforum@gmail.com, and we will get back to you. I would now like to invite our panelists, Dr. Suprity Chowdhury and Dr. Shruti Sarkar, to join us for the Q&A session and help answer questions from our participants. So let's begin with our first question. Our first question: I have completed AMC MCQ, English proficiency test, and now trying to enter Australian healthcare through upcoming RMO campaign. But my final goal is to become a GP in Australia. As I am still in Bangladesh, what would be your suggestion for me to prepare for AMC2 or to try and complete MRCGP in the meantime? Because MRCGP completion will allow me into the PEP pathway. So who will answer this question? Maybe
I can try, yeah. So it's a really good question. And I think we have discussed some part of the questions in our webinar, but some part I think we should answer here. Yes, it is always good to continue prepare the MC2 exam, because the MC2 exam is not quite easy job. It requires long-term preparation and improve the communication skill. And you know that in our country, we are not quite good at communications with the patients, and total different scenario, total different patient demographic you need to go for with the MC clinical. So it is always recommended to continue the MC clinical exam preparation, try to get to the process, try to find like ace the exam as early as possible. That's fine. As I told you, you can also get to the GP practice without the MC clinical. So after passing the MC MCQ and English, you have already done that one. So try to get the GP job offer along with the RMA campaign that you're trying to get. But if you wanted to become a GP in Australia, as I told in my speaking, that try to get the GP offer with the different size jobs searching sites, then pass the PESCI, get into the system, as the MC clinical after getting into the system, or you can pass the MC clinical before getting into the system, whatever you like. And yeah, there's the one part of the question. Another one is that MRCGP. Yes, this is a new pathway basically. So Australia in GP practice, they are taking the MRCGP. The people those have done, and the different pathway, though we are not discussing that pathway today, but I can answer that. There is yes, if you have completed the MRCGP, in that case you will be eligible for the competent authority pathways, and you can enter the GP system, the training pathway. Yeah, you are right, pay pathways. Yeah, that is totally fine if you wanted to do that, but it takes a lot of like the patience and a lot of commitment to complete, and a lot of focus. Yeah, definitely. If you are focused, you can do that. Yeah. Thanks.
Do you want to add anything else?
I would like to add one thing regarding the RMO campaign job. There are still many ways. If you become an RMO in any of the hospital in Australia, still after getting your general registration, like when you will complete the rotations in Australian hospital and will get general registration, in the meantime when you are working in hospital, if you can secure a job in a medical center, because if your ultimate goal is to become a GP, so my suggestion, if you still can work, you can still work as an RMO, but in the meantime you can, after getting general registration, you can try for AGPT pathway directly. Like there is a still option from hospital job, you can switch when you secure a RACGP approved pathways like GP training pathway. You can still go to the AGPT pathway or any RACGP accredited pathways while you are working as a in hospital. Still you can go for GP jobs in the meantime after getting general registration. You do not have to, I think, pass the AMC clinical for general registration when you completed all the medical terms as required.
Thank you. So the next question, I have AGPT exam coming soon, CASPE test, how to prepare for that?
I'm going to answer these questions, Dr. Mansurul.
Sure. Yeah.
At first, I would like to congratulate these doctors. I know we don't have a name, but this doctor has been enrolled himself through the AGPT ACRAM pathway. So the ACRAM comes with the CASPA test. So that means he has the general registration and he has the visa. So he has the permanent residency, or he is currently the citizen in Australia. So a big congratulations to him. And then AGPT, as I said before, that it is actually the very well-known program and is very supportive. Now, my pathway was not through the ACRAM, but AGPT through RACGP pathway. But I have a basic understanding of this CASPER test, and through those basic understanding, I'm going to answer this question. So I might have a bit of a lacking answering this question. What I want for this candidate to just check that ACRAM website, talk to the supervisor and medical advisor or medical educators to get the proper understanding. I'll just give you some tips and tricks, and I think that will help. My understanding that the CASPER is actually involves mastering the GP situational judgment test. It's kind of that format, which comes with both the written and video response, and it could be quite quicker. So you should have a very good typing speed. So your typing should be over 80 words per minute. That will give you an extra thinking time as well. If you're a slow typist and you will struggle to complete all 3 questions in a block, then it will be a problem. Sometimes what happens, if you finish a question early within a section block time, you can add that remaining time to your bank to use your next questions in the same block. Now, as we all know that ACRAM goes through the rural journalist pathway. So you have to demonstrate your empathy, your ethics. You have that rural journalist mindset. And that will be checked when you will be sitting in that exam, especially the video one. Now, there is no other options than practicing multiple times. You should dedicate your practice sessions to time scenarios that mirror your real world GP dilemmas. Review so you do your model answers. You can do it at your GP practice. You can do it on the videos. So you will make sure that you have some questions, some model questions, and then you can answer. And then just do it in the mirror. Just check that how you have responses those questions. And if you think like you can improve, the best way, if you find out some group mates, and then do the group study together. So the other group mates will ask you questions, and then now when you are selecting a group mate, you have to be very tricky. You should not be finding a soft one who is very softly telling you, okay, maybe this is that. That doesn't work. So you have to find out a strict one who would be a bit rough, rude at your face, but that will help you in the future. Okay. Now there are some websites that is helpful for medical preparation, courses like GP Institute of Praxis GPSJT for targeted exam preparation. Now, I could be wrong because I don't have much information about the AGPT CASPER test practice websites, but hopefully this one will help also for you. Thank you and congratulations again.
Thank you. So the next question. I am working in Bangladesh, past AMC, MCQ, interested to work as a GP through PESCI pathway. I need proper guidance about this, how to secure a job. It's look very tough. Is it possible? Maybe it is for Dr. Mansurul.
Okay, fine. First of all, congratulations, doctor, for passing the AMC MCQ. So you will know exactly the same, the situation that I was at the time. I can still remember on that day. I also asked the same question to my seniors and to my peers that is it possible to get to the Australia after passing the AMC MCQ? And you can see. And this is the the main goal of this today's presentation to inform you that you can get to the GP practice even without AMC clinical. So after passing the MCQ, yes, you need to get a GP offer to get to the PESCI. And getting the GP offer, sometimes it is very tough. That's why I gave you some tips. You can try independently to apply different website. One is like, as I told you, RACGP GP Recruit. If you go to the RACGP GP website, if you see that the GP Recruit, and you can see lots of jobs over there, and try to apply each and every positions, whether it is meeting your standard or not, because you don't know, you will be getting the call from nowhere sometimes. And another one is the big one is, as I know that Rural Workforce Australia, all the states, they have different websites, and randomly all the GP practice, basically they put the job offer over there. So you can pick the job of you can directly call them. Yeah, you can get the number over there. You can upload your CV over there and try to chase you offer, like, the application, what is the stage. And the important thing is that I tell you that interpersonal communication, basically, this is the most important one to get the GP offer in Australia, because sometimes quite recommendations from your seniors, from your friends with the same medical college, or someone that's working on that GP practice, they can come in very handy. So they can provide you some GP offer as well, so that you get to the PSK and come to Australia as a GP. So it is quite possible. It is, yeah, it's tough in terms, it depends. Like, if you are not quite, like quite good communication with other people and you're isolated people, in that case, it would be really tough for you. But if you're a little bit open, a little bit asking questions to others, and like communications, and try to see each and every place, and if it's flexible, in that case, it would be really achievable. And like, example is me, basically. I have done exactly the same way that you are doing now. So I think it is really, really possible. Thank you.
Thank you, Dr. Mansurul. And yes, it is possible, as you mentioned. So the next question, which has better passing rate, via AGPT pathway or FSP? Maybe Dr. Shruti can reply this.
Yeah. Thank you for the question. It's a very interesting question. RACGP, actually, both exams, all the RACGP fellowship exams for all candidates, it's qualify for them same, because they use the same standardized process of examinations. So all candidates will face the same AKT, same KP, and same CCE exams. RACGP normally doesn't publish officially the passing rate differences, but from my practical experience, I can definitely tell you there is a big difference between passing rate of AGPT and FSP pathway candidates. So in my opinion, and from my exam experience, I can tell that AGPT candidates are passing far more better than FSP candidates. During my time, I saw that. And there is a big difference from first time attempt exams candidates. So what I'm trying to say, who are attempting for the fellowship exams for the first attempt, the passing rate significantly changes. So when the people apply attend for second attempt and third attempt and fourth attempt, the passing rate significantly goes down. But I am not 100% sure about the cause of that. But I found actually clinical data, proper data from RACGP about the significant passing rate difference. Now, regarding the FSP, I do not want to discourage anyone for going to the FSP pathway, because it is one of the most popular pathway apart from AGPT now. Because recently FSP also increased the module, clinical educators and specific modules for and standardized time frame for every candidates, because I think they are more structured now. So I know the RACGP, like FSP and AGPT, has more structured than AGPT pathway is more structured, but FSP is also trying to change their thing now here. If you want to add something, Sharmin, you can add here.
So I think, Dr. Shruti, you have answered all the questions. What I believe that AGPT, as it is more structured, I mean, AGPT, we also have supervisors, but we go outside, we sit in a group sessions with other doctors as well. We do the practice over there. And then we have frequent ECT visitors. We have mini MCQ with our supervisors. We have some randomized control sessions as well with our supervisors as well. And we have to do That's also for FSP as well. So we do the midterm assessment, end of term assessment, which I believe that in AGPT is quite organized and quite strict. Because you have to follow those guidelines, rules. You have to go and sit with a medical educator for 2 or 3. They were asking you questions. And it's kind of like through all of these pathways, they will kind of make you ready for the APT KSP exams, and also how you're gonna sit for that CC exams, how you're gonna just prepare yourself. Considering all of this, based on, I think AGPT is a bit better. Whereas FSP, I have few friends who have passed through FSP, which is very good. Now, FSP is kind of what I feel that is bit like just sitting in a one place, just with getting your help from the supervisors only, not going outside and sitting with in a group with other FSP candidates, which maybe I think have a bit of a lackings of the guidelines, which can help ultimately to pass the exam.
Thank you. So the next question, is it possible to bypass the AMC clinical and get to the fellowship if someone progresses through the FSP pathway? Please elaborate on this. I think kind of same question. But anyone want to add anything in this question, or I will go to the next one?
I think Dr. Mansurul Islam already answered this question, because there is chance and there is option of bypassing the AMC part 2, given the passing rate in AMC part 2 is quite low in nowadays. Lots of candidates are doing through FSP or PESCI pathways. So they are doing supervised trainings for 12 months under a GP supervisor. And then by that way, they are getting their general registrations. And while you get your general registration, you do not need AMC clinical too. And I have one friend and colleague who never passed AMC 2, but she got general registration through GP pathways. So if you can get general registration through GP pathway, because she became a GP in Australia by passing PESCI. So AMC part 1, then English, then PESCI, then work 12 months under supervision, under a GP supervisor in a community-based GP practice. And then when you fulfill all the criteria, get the general registration. And while you get general registration, you will, in the meantime, you will prepare for your fellowship exams. And once you secure your fellowship, RACGP fellowship, you do not need AMC clinical too. So still possible, in my opinion.
I can add something here in terms of getting the fellowship without AMC clinical. So it is always recommended to pass the AMC clinical to secure the general registration. So because limited registration, it is not endless. You can maximum 3 times renew your limited registration. But when you enter the fellowship, you have 3 years time after completing the 2 years FSP program. So within the 3 years, the 6th term, you need to complete the fellowship exam. But you can see that you got the limited registration 2 years ago. Then you entered the fellowship pathway after 2 years. So you see, you have only the 2 terms of for the renewal of the limited registration. So at some point, you may lose the registration if you don't pass the fellowship at first or second go. So if it takes more than 2 times, 3 or 4 times, in that case, it'd be tough sometimes to continue work as a GP. So you may need to lose the registration, then going the exam, then passing the exam, then come back to the GP practice. So sometimes it would be tough. So it is always recommended to pass the MC clinical, get the registration, and then go to the fellowship pathway to secure yourself. Yeah.
Thank you very much. So the next question, I'm working in Maldives as a medical officer under Ministry of Health. Will MRCGP South Asia can give entry rather than AMC route? Want to know this pathway details with pros and cons? Thank you. So, Dr. Suprity, can you answer this?
Yep. Yeah. Thank you, Dr. Roman. So that is actually a new pathway, the PEP specialist pathway. So if you have a MRCGP international, if you have passed the MRCGP international pathway, then you need to apply to the RACGP for the assessment. Then they will give you a partial compatible to as a work as a GP in Australia. But for this, you need to get a job offer. And usually after, as I heard, that through the PEP pathway, you will get level 3 supervision. So the chances actually nowadays is more, given that in the rural area, the doctor, supervisor doctor, they want the level 3 supervision. So if you have a RACGP international, just get a job offer and then apply for this assessment, the PEP specialist assessment. So once you started working as a level 3 as a level 3 GP, then maybe after 1 year, you can apply for the fellowship exam, and then you will sit on the exam, and then it's completed. So as all the Dr. Sharmin and Dr. Mansurul will explain everything about this AGPT or FSP pathway. So through that MRCGP International Southeast pathway, now your GP, the fellowship will be shorter. So it will be done within 2 years. You can finish your journey and become a fellow in Australia. So yes, it's a good opportunity. So I think nowadays people are coming from different countries like Sri Lanka, Pakistan, and India through this pathway, and they are securing a job quickly. So if you don't want to go for the AMC exam, then yes, MRCGP South Asia is the opportunity. So you can go for it and then talk to the different GP center, get an offer and apply for this pathway, and you'll secure a job quickly. If someone can add, I think Dr. Mansurul, if you have any idea, or Dr. Sajid, you can add something.
Stuck in, I'll just give some information. So we are going to do one session with MRCGP International with a few people who came to Australia on this pathway. So please keep an eye on our website, either through this platform or some other platform. We'll do that. So there will be a long discussion on this. It's a completely different topic because it's an specialist pathway, literally, partial specialist pathway. So we will do a different webinar on it. So please keep an eye on it. But I think Dr. Suprity and Dr. Mansurul has already answered the question. It's a completely different pathway. It's a new pathway. You need 4 years full-time general practice experience in Bangladesh, and you have to pass the MRCGP International. Then you can apply for it. I think it's a slightly different pathway, but we will talk about it, more details. Thank you.
Thank you very much. So the next question, Dr. Sajid, please respond this one. Can we have the today's presentation in our email, please?
We will send everyone the email or YouTube link, so you can actually watch the video, and all other videos we have already done, the webinars, you can actually see in there, and the link will be available within next 24 to 48 hours and email to you. Thank you.
Thank you. So the next question actually was directed to Dr. Sharmin Akter. My question to Dr. Sharmin Akter, as my pathway is similar like yours, I obtained my general registration via AMC exam and hospital rotation under level 2 supervision. 1 year general medicine, 6 months general surgery, 9 weeks ED in total. I am aiming for RACGP AGPT entry in January 2027. My first question, does the CASPA test determine entry into training? Second question, will my hospital rotations count towards the hospital year, considering I have not done pediatrics term and my ED term was only 9 weeks instead of 12 weeks?
Okay. This is actually a very detailed question. Yeah, a good question indeed. Okay. So the first question, CASPA test is determining entry assessment for ACRM and RACGP entry assessment. Now, every GP training pathways have different entry assessments, but CASPA is for AGPT and ACRM, RACGP and ACRM AGPT training pathways. Now, the second question is, my understanding is Azmira I'm just not sure if she has been doing GPT 2 or GPT 3. Now, she has 1 year gen med, 6 months general surgery, 9 weeks ED. Are all of these have been completed in Australia? Okay, now we need internship, and then followed by internship, we need also the hospital rotations as well. Now, the second question that she has asked, secondly, will my hospital rotations count towards the hospital year? Hospital rotations will count towards the hospital year, that's true. Considering I haven't done pediatrics term and my ED term was only 9 weeks instead of 12 weeks. Now, you have to complete your hospital rotations, otherwise you'll not be eligible to sit for the entry assessment. Now, another thing is, as you did your 9 weeks of ED, sometimes we follow a logbook in emergency department and we see pediatric patients. If you follow any logbooks, then you can add those experience as your pediatric training, or you still have time, so you still have 7 months. If you go and talk to your rostering or junior doctors, supervisors, or the registers who support the junior doctors, if you ask them that this is your goal and they support you and you can go and do the ED term for next 6 months, or you don't need even 6 months. If we are counting that it's 12 weeks of pediatrics and you need maybe 4 or 5 months. So count all of these and maintain a logbook for your pediatrics. And also you can work in an emergency department as well. Otherwise, work 3 weeks in ED and rest of the time you have to work in pediatrics. What I did for my pediatrics, I didn't get the rotations in pediatrics, but I did the diploma in child health, so which covered 6 weeks of my pediatric rotation. Now, if you had any kind of pediatric experience from overseas or working from any other hospitals, and if you have those documents, they can also submit those documents as well. If there is anything else to add, Dr. Shruti or Dr. Suprity, in this question?
No, I think you have answered. Yeah, that's really good.
Okay. Thank you very much. So the next question, this is Dr. Islam. Being a MRCGP International South Asia, I need to know pathways in regard to job offer.
I think we answered this question before. There will be a separate webinar on this particular matter because it's quite a big topic and its requirement is quite stringent. So I think we need to go through that pathway, how many years, what experience you need, and MRCGP International exam pathway. There will be people coming to talk about it who actually done it. So please keep an eye on it. We will actually talk about it with the people who actually done it. So you are going to get a first-hand experience from them rather than I giving you some information. So you keep an eye on it. We will definitely give it to you. Thank you.
Thank you very much. So the next question. I have passed MCQ exam, my English exam scheduled next month, and I'm also preparing for my clinical exam. So is there any observational program available for us, or can we get any scope to observe the health system? I am right now in Bangladesh and holding a visitor visa.
I think I can answer it. So he passed the MCQ and he's going to hold visitor visa. I mean, he's planning to visit Australia and get some observership experience. Please communicate with us and let us know when you are coming. We will definitely try to give you some observership any of our clinic to give you some experience. So that will be open for you. It's Mr. Sheikh Mahmoud. So you just give us an email and then we will communicate with you when you come to Australia. We'll try our best to give you the observership.
Okay, thank you very much. So the next question, I am currently working as a RMO in Bangladesh. What kind of jobs in my home country will help me getting GP jobs in Australia?
I can answer that. So as a RMO, if you have experience 2 to 3 years after the internship, you can also apply for RMO in the Australia if you have completed AMC, MCQ, and English. So there are, as we have discussed our previous webinar regarding how to apply all these RMO campaign. So just watch that webinar, and if you have any question, then email. But yes, as an RMO, you can apply all the hospital in Australia in different states through the RMO campaign, and they have a RMO campaign in different times, usually in June, but you need to complete at least AMC, MCQ, and English test.
I want to add one thing about this. From overseas, if someone apply for RMO campaign jobs in Australian-based hospitals, it's actually the chances of getting interviews, it varies from person to person, and it also actually very individualized. So there are people, some who are applying for hundreds of jobs, not getting any interview calls from Australian hospitals, depending on their experience and personalized and the application process. Also, I want to say about the CV and the resume writing as well, because Australian resume, like they need to have some standardized process. Actually, it's going to different pathways, but I think what I'm trying to say is that by only passing AMC Part 1 and English, and even you have experience working in Bangladeshi hospitals, sometimes the chances can vary from person to person, and it's always depends on personalized experience and the quality and standards of your like resume as well. But there is still chances you can get job offer. But in my opinion, in the Australian hospitals, they actually prefer to give job offers who have passed their AMC clinical more than. Do not want to discourage, but I have heard that. Not 100% sure though. Dr. Islam can tell about that little bit more. I think. Yeah.
No, thank you. Thank you. I think she explained to you very well. So I think follow that. That should be all right. But getting a job from Bangladesh into RMO campaign is unfortunately very hard, but it's not impossible. But I think best is to get some experience of anesthetics, emergency medicine, ICU. I think that will help you. So if you have experience in that and some pediatrics, I think that will be very helpful. But this three categorically is very, very helpful in your CV: ICU, emergency medicine, and anesthetics. Thank you.
Thank you very much. I hope it will help you. So the next question, after completing AMC MCQ, do I go for MRCGP or AMC clinical? Which will be better if I have more than 4 years experience as in GP?
I think both pathways are okay. Both pathways are okay, but MRCGP International is a different pathway. You have to have a 4 years full-time general practice experience you need. I'm talking about full-time. That means you can't work in between hospital and come back. It has to be 4 years full-time GP. So you have to prove that. But obviously the pesky pathway, which Dr. Mansurul has explained to you from Bangladesh, I think that's another very, very good choice. Still, it's a very good choice. You should try on that pathway.
Thank you very much. So the next question, after AMC Part 1, how can I get GP offer letter? Can you suggest links which offer IMGs the GP offer letter without AMC clinical? Is it available all through the year, or I should try during campaigns?
Try that. So, yep. So we have already discussed about getting the GP job offers. We have RACGP GP Recruit website, and as well as the statewide health workforce Australia, and you can work over there. And the best way, communicating with particular GP practice, and the people those are already working, known people, and you can try it through that way. In terms of yes, without MC Clinical, you can get the GP offer basically, and we discuss all of those things in our webinar today. And in terms of available throughout the year, GP job offer is basically is not related to any campaign. It's all individualized, and not any particular season, not any particular time. Every month, every year, you can just try to get the GP offer. It doesn't depend on campaign like hospital. Hospital is different. They have the different campaign state-wise. They take the applications and choose the people and get into the system. But GP is different, individualized solely. So it is not really generally campaign. You need to pick the like GP offer in with these different ways that we have discussed. I think we have answered the questions already. Okay, thank you.
Thank you very much. So due to the time limitation, so it was our the last question we could take. There are few more questions in our email and inboxes. We'll reply them.